cover today. Just a couple of housekeeping things before we get started. So if you're new and you just started joining, I've just asked people to share where they're from in Florida, which county, what organization they represent, and the temperature. Jody and I will share a little bit more about ourselves, but we're located in Iowa. So especially when I do my southern webinars, my Florida webinars, I really like to know, because I just envision you all just going to the beach in the afternoon. And I know that's not the case, but I like to dream, right? So a couple of housekeeping things. This is being recorded. We do have people still joining, so you are automatically muted, and your video is off. We will turn our videos off here after introductions, just for no distractions and making sure the videos play okay, and then we'll turn them back on after the presentation to answer any questions. If you have questions as we go, feel free to ask them either in the chat box or the Q&A, and we will definitely address all questions at the end of the presentation, but I don't want you to forget those questions. There's a chance we might answer your question, but still put it in the chat or the Q&A, just so we don't miss it and you don't forget it. After the webinar, either today or tomorrow or the next day, sometime this week, you will get a follow-up email with a PDF of the slides. You'll get additional links that we'll talk about today. You'll get the recording so you can share it with all your colleagues. So expect that webinar to come, or that email to come after the webinar sometime within the next day or so. So you'll get this. So like I said, we have a lot to cover in 60 minutes. Thank you for giving us your lunch hour today. We're very excited to be here to talk to you about Count the Kicks. Huge shout out to Florida Department of Health. It's because of this partnership with the Florida Department of Public Health that we are here, that we are talking to you about Count the Kicks, a stillbirth prevention evidence-based campaign today, that we have free materials that you can order, that you can access trainings and online CE trainings. We launched originally in 2020 with Count the Kicks in Florida with the height of COVID. And we've been there and we've seen huge success. And so we're just so grateful for this continued partnership to help save babies from preventable stillbirth in your state. And we're glad you're here. So your presenters today, you guys are lucky, you get 3 of us. So this is super exciting. I'm obviously Megan Ockett. I'm the program director with Healthy Birthday, which is the nonprofit organization that created Count the Kicks. So think of Healthy Birthday Inc. as the umbrella, and then Count the Kicks is the main spoke or pole that holds up the umbrella, the evidence-based stillbirth prevention campaign. I've been with the organization for 3 years. My background is in public health. I used to work for Iowa Department of Public Health. I mentioned earlier, Jody and I are both from Iowa natives. I have been to Florida though. And my background's in public health, and I've worked for Iowa Department of Public Health in maternal child health and tobacco cessation for a while. Maternal child health is my true passion. I love education and empowerment, and I love everything that this program embodies. The fact that it's empowering, it's bright, colorful, it's educational, it's just giving people the tools and resources to be able to understand what's normal for their baby. And so I am excited to be here today and be sharing our passion with you, and hope that you take some key things away to share with your expectant parents that you serve. And I will let Jody introduce herself.
Yeah, thanks, Megan. Hey, good afternoon, everyone. My name is Jody Long, and I'm serving as the Health Equity Director for Healthy Birthday Inc. And I've been with the organization now for about a month, so I'm still pretty new to this. I have a background in TV journalism. I was a news anchor here in Des Moines, Iowa for about 10 years, and just made the hop over to the nonprofit side after having done several stories and reports with all the amazing work that Healthy Birthday and Count the Kicks was doing in our state and throughout the country. And so I came over to work for this amazing organization, and I'm thrilled to be a part to help reduce the racial disparities that persist in stillbirths in this country. So enough about me, but I want to introduce you to our ambassador in Florida, Jennifer McInnes, and she'll tell us more about herself. Hi, Jennifer.
Hi, thank you so much, Jody. My name is Jennifer McInnes, and I am a Florida Count the Kicks ambassador. There are 2 of us. So I am located in Indialantic. So that is in the Melbourne area. So think center of the state, but head east, close to the beach. No, Megan, I'm sorry, I don't live on the beach. I wish I did. But I have been an ambassador here just for a few months. We actually have another ambassador. She's located over on the West Coast, over in the Tampa area. And I'll talk a little bit more later on about how, as an ambassador, I can help you and be available as a resource. But I do want to share with you why I found Count the Kicks. So unfortunately, I didn't find them soon enough. And back in January of 2021, I delivered our son Jonah stillborn. And not once during my pregnancy, and we were a very high risk pregnancy because our son had Down syndrome, we were never properly educated on tracking fetal movement. And I actually interacted with 5 different care providers throughout my pregnancy. And so when my son stopped moving one day, I went into the hospital and unfortunately heard those words that he no longer had a heartbeat. And we were originally told that sometimes these things just happen, and his death was considered unexplained on our hospital discharge papers. But we eventually found out that he had clots in his umbilical cord, and there was evidence of repeated cord compression. And while those 2 things are not biologically preventable, we did have an early warning sign, but we had no idea that our son was in distress. So about 48 hours before I delivered him, I felt very sharp, frantic kicking from our son. And at the time, we were just thrilled. I called my husband over. It was one of the first times he could actually feel movement from the outside. And we were just so excited. We thought maybe he loved what I ate for dinner. And it turns out, looking back, I now would describe those kicks as frantic. And we now know that our little baby was in distress and we had no idea. So I eventually found Count the Kicks and saw that they had launched in Florida. And I am trying to do my best here to emulate what they did in Iowa in helping all of you save as many babies by bringing these awesome educational materials to our parents. So I just want to take a moment and thank all of you for taking the time out of your day to be here. I know we have people from so many different network agencies, people that see our expectant parents individually. And as a stillbirth parent, I am so, so grateful that you are doing this for our expectant parents.
Thank you, Jennifer. And thank you for your honesty and your bravery and sharing Jonah with us. We send you all of our love, and he is so loved. And so we're happy to be talking in honor of Jonah today for you and all those babies. So you know a little bit about us. As I mentioned, we're located in Iowa. So one of the first things I like to share is a video that aired on Good Morning America in 2017. And if you've been to our presentation before, you know that this is an inspiring video, that this is a moving video. But I also share it because it does a really good job of showing you, if you're not that familiar with Count the Kicks, how it works and how the app works and truly the impact it can have. I also share it because we might address a couple of the things that the mom says in this video, but I also share it to help you understand the importance and the power of storytelling. You just heard Jody tell you that she was a news anchor for 10 years, and she knows firsthand the power of storytelling, right? Like she used to do it day in and day out. So when this aired on Good Morning America, we saw our app downloads increase around 3,700%. Huge spike in app downloads. And so anytime you have the opportunity to share a story, to share one of our videos from our YouTube channel or our Baby Safe Stories, which we'll talk more about here in a little bit, please do so with your expectant parents, because this is what they're going to remember. Today, when you leave, you're going to remember baby Ruby, you're going to remember baby Jonah, you're going to remember baby Nala. All of these babies that we talk about, this is what's going to stick out in your mind. So let's go ahead and watch this Good Morning America video so you can learn more and feel the power behind this campaign.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So Jennifer is going to talk about the app in a little bit more detail later, but we've had over 200,000 downloads in 140 countries. It's completely free. So we're excited to share more about the app and some of the updates that we have to it. But I love sharing that video, and I love that little baby stretch by baby Ruby at the end there. So feel free to share that too. It's on our YouTube channel. It's on our website. So just a quick overview before we dive in is the fact that, just so you know, Count the Kicks is an evidence-based stillbirth prevention public health campaign. I'll talk about the evidence and research behind the campaign coming up, but it's a true early warning system for expectant parents. What we're doing and what you'll be doing is educating expectant parents on the importance of tracking fetal movement, getting to understand what's normal for their baby. And we'll talk about that word normal here coming up. In terms of fetal movement through the use of either our mobile app, which you just saw, or we have paper kick counting charts available online. And what I love about this campaign is that it's empowering, right? It's bright, it's colorful, it's empowering expectant parents to speak up to providers if there's a concern. In Iowa, we're saving 1 in 3 at-risk babies. So we know 1 in 3 at-risk babies can be saved with Count the Kicks. And we'll talk about how we got to that number in a minute. But that's what we want to bring to Florida. We want to bring this 32% reduction that we've had in Iowa in the stillbirth rate to Florida, and we need your help. So just to level set, I know based off registration, you all probably know the definitions between miscarriage, stillbirth, and infant mortality. But what I want to draw your attention to on this page, on this slide, is the fact that we're losing around 23,500 babies every year in the United States to stillbirth. And infant mortality, we're losing on average around 22,000 infants die every year. And so we're losing just as many babies to stillbirth as we are to infant mortality, but we don't talk about it. And this is not to underscore the devastation and tragedy that infant mortality is. What it's supposed to do is to highlight the fact that we should be talking about stillbirth and stillbirth prevention just as much as we're talking about SIDS prevention and laying your baby on its back to sleep and not smoking around baby and circulating a fan and sleeping in the same room for 6 months, all of those prevention methods. That's what we want to do today. We want to give you the tools and resources to be able to talk about stillbirth prevention and fetal movement monitoring, just like you would talking about the importance of the Back to Sleep campaign. This is 65 babies a day we're losing. If that's a busload of kindergartners, we would be talking about that, right? So why aren't we talking about that? This is why you're here today. So you can start talking about this and we can change this narrative.
Right, thanks, Megan. So now that we know those important terms and definitions, it's important to talk about some of the numbers linked with stillbirth. We're going to look at the national data first, then we'll look at the data there in Florida. So all of this information is from the CDC. 1 in 169 pregnancies in this country end in stillbirth. And racial disparities do persist in these numbers, mostly impacting Black, Indigenous, and Hispanic moms. For Black moms, 1 in 96 of them will experience a stillbirth. That means Black moms are twice as likely to lose their baby to stillbirth when compared to their white peer, neighbor, or friend. When we're talking about Hispanic moms, that's 1 in 199. And for Indigenous expectant parents, it's 1 in 138. Now, if you look at the numbers for white expectant parents, that number jumps up to 1 in 204. And for Asian and Pacific Islanders, it's 1 in 233. A number that really stands out to me is that families are 10 times more likely to lose a baby to stillbirth than SIDS. Also, let's take a chance now to look at the data there in Florida. This is from 2020, or 2020 rather. This is all collected by the Florida Department of Public Health. In the state of Florida, 10 Black babies are born still to every 1,000 birth. That number is nearly 6 for Hispanic babies and 5 for white babies. So you can see some of those racial disparities that we're talking about that really can be seen not only in your state, but really nationwide. By using the same method of Count the Kicks in our home state of Iowa that we used here, we figure that we can save 481 babies in Florida each year with the use of Count the Kicks. So that is our main goal.
Yeah, and I'll just add here quick too, Jody, and Casey Omeki's on. She's our contact at the Florida Department of Public Health, but the Florida Department of Public Health has an amazing data site, and I'll send it in the webinar follow-up, but you can actually search for your county specific data if you're interested in that. So you can kind of see where your county ranks in terms of comparison to other counties, comparison to the state as well. And that's a really good, useful tool to have. And I always give a shout out to the EPIs and the data team there at the Florida Department of Public Health, because it truly is an amazing, amazing website. And I see a lot of websites around data, and they are by far the top rated in my mind. So I'll send that out, or if Casey's on and listening, she can go ahead and put the link in the chat too. So go ahead, Jody.
Yeah, we know that data really tells the story, and that's the case for our state in Iowa, that our Iowa data shows right here on this map, kind of the life of our campaign. That red line you see at the top represents the national stillbirth rate, and the dots and the trend line beneath it is our Iowa rate. That starts in 2003 and goes all the way through 2020. So where the blue dot meets the red line at the top there, kind of like a third of the way into the graph, represents 2008, the year that our campaign started. And you can see the trend line really goes down from there. The CDC, though, has not released data from 2018 for the US just yet. So that's why the national data kind of stops sooner than the Iowa data beneath it. But one important note to point out here is that the majority of the US has remained pretty stagnant in their stillbirth rates, whereas Iowa's rate has actually decreased. Now, of course, there's going to be some years where it fluctuates up and down, but it's important to look at data from a yearly basis and on averages. For example, a large syphilis outbreak or any other outside factors could cause a spike in stillbirth rates, but there are a variety of factors that could lead to an increase or decrease in a state's stillbirth rate. But one important takeaway in Iowa, for example, is that even when risk factors like smoking increases or even the obesity rate increases during this time frame, our stillbirth rate still saw a steady decline while the rest of the country remained stagnant. These numbers are from 2021. The preliminary Iowa stillbirth rate then was 4 fetal deaths per 1,000 live births, which is actually the second lowest Iowa stillbirth rate on record after 2018, which was at that time the lowest in the country. So I want to take a moment to circle back to the racial disparities that we talked about earlier, with Black women being 2 times more likely to experience the tragedy of a stillbirth. So you might be asking yourself, why is that? So research shows that there are a lot of factors that are contributing to this. So we want to note that Healthy Birthday has reviewed plenty of articles on these points and have various articles to point back to. So if you're interested in seeing some of those documents, we would be more than happy to share those with you and tell you where we got our findings from. But researchers do point to a few causes for these disparities happening. Systemic racism being a major one. And with that comes toxic stress. Research shows that years of being treated unequally or unfairly, essentially being a Black woman in this country, can lead to some real and pervasive health issues. Another term that you may or may not be familiar with is the term epigenetics. Epigenetics is the study of how your behaviors and environment can cause changes that impact the way that your genes work. So unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they can change how your body reads that DNA sequence. So that can have an impact on women too. Also, things to consider are predispositions to certain conditions that may lead to stillbirth, like gestational diabetes or preeclampsia, which I experienced in my pregnancy over the summer, which are all linked to maternal stress. Experts say that Black women are less likely than other races to receive early treatment on these conditions. So that's really important to note as well. Some other things to consider are access to healthcare and socioeconomic barriers. But get this, research shows that education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. I always kind of point back to the example of Serena Williams, the GOAT, the greatest of all time tennis player, nearly lost her life giving birth after her daughter. And she had access to all the best healthcare and resources. And she was still at risk of losing her life and putting her baby in danger. So we spoke about the why this is happening, right? But let's talk about what we're doing about it. We're all solution-based here. Our Count the Kicks app, which is free, is available in 14 different languages. How cool is that? We're trying to meet everybody where they're at there. We also include diverse and inclusive educational materials featuring women of color and even low literacy brochures that are picture-based for those expectant parents whose first language might not be English. So in your state of Florida, our posters and brochures and other materials can be found in English, Spanish, and Haitian Creole. The organization also created its first ever health equity team this year, made up of a small yet mighty team of myself serving as the health equity director and a health equity coordinator. Our team is leading the organization's efforts to reach and educate moms who are more susceptible to poor birth outcomes. We're also always looking for funding opportunities to reduce racial disparities that persist in stillbirth. And one of the ways that we're doing that is by utilizing funds to translate our app into different languages and some of our materials that we just spoke about earlier. Also, our organization staff and board receive yearly anti-oppression and structural racism training. And we also work within the communities considered to be marginalized by improving programming based on their lived experiences that they share with us. So as we learn more about the issues that they're facing, we can identify solutions and work with our partners on implementing that in their area. Another thing that we have tried here in Iowa that has proven to be really successful is salon and faith-based outreach programs. So we make sure that our materials are in local salons here in town, as well as churches, and educate those working in those areas on talking to those who are receiving their services to know about counting their kicks, because we know that sometimes parents may be more susceptible to receive information from a trusted pastor or someone in their friend group rather than a doctor. So I want you to take time to think about ways that your organization could do something like this as well.
Thanks, Jody. So Jody did a great job talking about the data, talking about the fact that we have seen a 32% reduction in the number of stillbirths here in Iowa. and a 39% reduction of stillbirths among African-American women here in Iowa. And so when we talk about the research behind the campaign, what you see on your screen is a quote from Dr. Ruth Fretz, who is a well-renowned researcher. She's also on our medical advisory board. But the reason this is on your screen right now is because this is highlighting a research study, the research study that really founded the organization. And so we were founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. And so, long story short, what these individuals, what these women wanted to do, where they didn't know each other at the time, and like Jody just said, they got connected through pastors and friends. And as they were grieving together, they thought to themselves, this is a lot more common than people think. Stillbirth is a lot more common than people think. We have very similar stories, and we're all sitting here with the same outcome. And so fast forward, one of the things that they did was create a stillbirth registry with some funds from the CDC. And it was because of this stillbirth registry. So in Iowa, a way to track trends in stillbirth, they were at a public health conference, where at this public health conference, they heard some researchers talk about this study that you see on your screen that talked about the study out of Norway that showed when expectant parents were educated on getting to know what was normal for their baby in the 3rd trimester, that among this cohort of women, the stillbirth rate decreased around 30%. And so the founders, these women hearing this, saying, that's amazing. You know, kit counting has been around forever, but the tools and resources for you as the maternal health provider, as the WIC, as the home visitor, the tools and resources for you to be able to easily talk about stillbirth and stillbirth prevention, and the tools and resources for expectant parents to understand the importance of tracking their baby's movements and how to do it, that has not been created. So let's go back to Iowa and create this. And so that's what they did. They came back to Iowa. They worked with Iowa Department of Public Health. They looked at other research, not just this one. We have a whole page dedicated to evidence and research if you're really into reading journal articles. And that's what they did. They created Count the Kicks. And one of their goals in 2007 was, if this could just save one baby, if this could save one family from enduring the loss, this tragedy of stillbirth, that would be their goal. That's what they wanted, if they could just save one baby. And here we are over a decade later with a huge decrease in our stillbirth rate, with hundreds of baby saves that we know about. We know there's more out there, with hundreds of thousands of downloads. And these founders are still involved 20 years later, you know, from the loss. And it's just so inspiring and impactful. So Dr. Ruth Fretz, one of the researchers on that Norway study, stated that tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern. There's that word again, starting at 28 weeks, and to speak up if they notice a change. So there's a lot of other research out there that you can review on our website. But the other things that I wanted to highlight are some of the top questions we always get asked. We always get asked about kind of like thinking through, I think individuals and humans, we kind of go to that worst case scenario, right? If I'm going to do this, I'm going to get all these calls from expectant parents. My nurses are going to be running around like crazy doing all these NSTs. It's just going to increase the anxiety in my patients if I talk to them about this. And I understand your concerns, but I'm here to tell you that does not happen. Kit counting does not increase anxiety in most pregnant women. Here's another research study that said one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. We've also done our own study of our thousands of app users through the Des Moines University and the Harkin Institute, and found that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. Using the mobile health app to empower mothers to monitor their baby's fetal movement, the researchers stated that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. And I'll tell you why. It's because now with the use of our app, or the kit counting paper charts, or the fact that they understand what's normal with their baby, with the app, they have data in their hands to say, I know what's normal for my baby. I know my baby takes on average around 20 minutes to get to 10 movements. I have data in my hands to show to my provider what's normal for my baby, and if something's off, what's not normal for my baby. there's also added benefits that I just don't think we always think about. Things like reduction of preterm birth. Fetal growth restrictions are identified earlier. I think we jump to the conclusion that somebody's going to come in with a change in fetal movement and it's going to be an emergency C-section. And 9 times out of 10, that doesn't happen. And the 10th time, maybe it's just an induction of labor. But the fact is, we want to make sure we get that one time, right? We want to make sure that we are meeting the needs of our patients and addressing their concerns. And sometimes it's just catching things earlier. Women who have stillbirths are also at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So this researcher states, due to the low cost and potential benefit, it's recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives, right? They're not coming in to get delivered right away. They're coming in for that further testing to make sure baby and the expectant parent is okay. So you heard me just say that there's an intrinsic connection between stillbirth and maternal mortality. You are 4 times more likely to die if you have a stillbirth. So we released a white paper on this very fact in earlier this year, and you can scan the QR code. I will send it in my post-webinar email. But basically, what I want to highlight here is the fact that if we can prevent preventable stillbirths, we also have a real opportunity to also save mom's life as well. So when we're talking about maternal mortality and morbidity, know that this is also impacting the lives of the pregnant individual as well. So now I'm going to turn it over to Jennifer, who's really going to talk about the meat of this, right? Like, how do you talk about this with your parents? Go ahead, Jennifer.
Oh, thank you so much, Megan. Okay, so now that you've seen all the research, you've seen all the data on how this is working to save babies, let's talk about how you can help expectant parents to make this work. Why does movement matter? Well, movement is one of the most important ways that our baby communicates with us before birth. And so we want moms, parents to get used to knowing what their normal is. So if there is any kind of change in baby's movement, that can be an early warning sign. And sometimes it's the only early warning sign that we have that a baby might be in distress. So what we're looking for, we're going to ask our expectant parents to look for 3 different types of movement changes. So the first one is a reduction in fetal movement. So if baby has fewer movements or no movements at all, essentially they're slowing down. And I always like to think of us as adults. What happens to us when we're not feeling well? I might want to go lay on the couch if I'm not feeling well. Well, babies might behave the same way. If something is going on inside and baby is not feeling their normal self, they might slow down a little bit. The second type of movement change we're looking for is changes in strength. So we could be looking for a reduction in strength. So maybe baby might be moving, but the movements are softer, the movements are a little bit weaker. That could be some kind of indication that maybe, for example, there's an issue with the cord. That's what happened, with our son, is he had a cord issue. And so the third option of what we're looking for with movement changes is actually sudden wild surges of movement. And that is how our son's cord issue manifested itself, is that we have these frantic kicks. So all 3 of these could be signs from our baby to us that our baby is in distress. And again, we're not saying run in and deliver the baby. We're just saying, let's be on the safe side. Let's reach out to our care provider. If you can't reach your care provider, head into labor and delivery, and let's just see what's going on. Let's check on baby a little bit. Okay, so we know kicks matter. So let's start counting. And so how do we want to implement this with our expectant parents? Well, we want them to start around 28 weeks gestation. We want them to have daily kick counting sessions. Now, if they are considered high risk, we recommend that they start at 26 weeks. And why is it that we choose this time frame? Well, research shows that by 26 to 28 weeks, baby has reached a consistent pattern that moms and expectant parents can feel and can track. And that's important because we're looking for that normal, consistent pattern. So when they start a kick counting session, what is it that we want to count as a kick? Anything like a roll, a kick, or a jab. And that might feel differently at 28 weeks. compared to 37 weeks. But any of those type of movements, we just want to make sure that we do not include hiccups, because hiccups are considered involuntary. And I want to mention one other thing. So sometimes care providers might wait until our patient reaches week 28 in order to teach them this. But I think as the person who is trying to educate, we want to be conscious of when their next appointment is. So sometimes if you are a low risk pregnancy, you are waiting 4 weeks before you actually go in and see your care provider. So if you go in at 25 weeks and that expectant parent won't be back in for 29 weeks, we would love for the care providers to be thinking ahead and educating parents on using the Count the Kicks app now, so that by the time they reach 26 or 28 weeks, that they know how to use it properly. Okay, so how is it that you can present this to your expectant parents? Well, the idea is we want them to be very in tune with their baby and with their body and get to know what their pattern is. Because for one baby, it might take them 60 minutes on average to get to 10 kicks. And for another baby, it might take 10 minutes to get 10 kicks. So it's not a matter of comparing them to some other expectant parent. It's a matter of comparing their baby's pattern today with what their pattern has been for the last few weeks. So here's how it works. Starting in that 3rd trimester, we want to teach them to begin counting. And so we have our app, which is free. As you saw earlier, it's available in 14 different languages. We also have paper charts that they can use. And we're going to teach our expectant parents to count their baby's movements every single day. We recommend they choose the same time every day. And what expectant parent doesn't want to be told, why don't you go lie down, put your feet up and take a moment and have a little bonding time with your baby? Expectant parents have a lot going on. So it would be nice for them to have a reason to stop and do what they need to do. Of course, it doesn't have to be done laying down, but that is one option. And so what they're going to do is start a kick counting session. And the app is going to log how long it takes them to get to 10 kicks. And after a few days of starting these kick counting sessions, they will start to see a pattern for their baby. And so these are the things that you would want to be teaching your expectant parents. You would say to them, you are going to start to see a pattern on your app of how long it takes your baby to get to 10. And if you are tracking this every single day and you notice any significant change in the amount of time it takes or in the strength, then we recommend that you call your provider right away if you notice a change in how long it takes. I just want to remind you, you've seen the research. This strategy works in saving babies. And the really important idea that I cannot impress on all of you enough to impress on your expectant parents is that the app is wonderful, but if the parent does not feel confident in expressing their concerns with their care provider, then it means nothing. And I say that because I've heard of a lot of anecdotal stories, but I think this is a lot more prevalent than we know. Parents who reach out and their care providers might be a little bit dismissive. And what you're going to see is that this app allows them to have data to show their care providers. And data means everything when you're talking about getting to know your baby's pattern. So it's just really important for us to empower parents to advocate for themselves and advocate for their babies. Okay. So this is one of my favorite parts of the presentation. What I am going to ask all of you at home or at work, wherever you are, I would love for you to take out your phones. And I am actually a 20-year high school math teacher. I work with teenagers for 20 years. And this is something that I rarely ever said in my classroom, but I would like for you to take out your phones. And I want you right now to download the Count the Kicks app. So I want you to open up your app store, whether it's through Apple, Google Play, whatever platform you use to access apps. And I want you to search for Count the Kicks. And you'll recognize it. You'll see that big yellow clock on there. And I want you to download that now. And the reason why I want you to download it, even though you might not be pregnant, is because I want you to become so familiar with this app that when you do talk to your expectant parents, you can just pull out your phone and say, take a look at how easy this is to use. And I would love for you to say to your expectant parents the statement, I want you to start using this to track your baby's movements, because expectant parents trust you. They are coming to you for your expertise and for your knowledge. And if you are showing them how easy it is to use that app and asking them to start using it, they are going to listen. They are interested in tracking their baby's health. Sometimes we fly blind in between appointments. This is one way that they can connect with baby and be able to keep tabs on how baby is doing in between their appointments. And while you're still downloading, I'm going to talk about some of the features on the app, and then I'll get to the good stuff, which is how to actually initiate a kid counting session. So you already heard that our app is available in 14 languages. Our two newest are Hebrew and Portuguese. In terms of starting a session, if a person starts a session and gets interrupted, they can always restart their session. They can also delete a kick. And one thing I want to mention is when an expectant parent is actually starting a kid counting session, this is an awesome opportunity to get families involved. You can get birthing partners involved. You can, if there are any siblings in the house, if they're old enough, they can help out in using this app. Maybe it won't be as easy at week 28, but the closer they get to term, it's going to be easier for family members to feel those kicks. So it can be a really fun experience for the whole family. And I bring that up now because if I hear stories of siblings helping out with tapping that cute little footprint you can see on the screen, and sometimes they tap a little too many times. So you've got to delete a kick if it actually wasn't a real kick. Another awesome feature of the app is it will automatically set a daily reminder for you to count the kicks. And pregnancy brain is a real thing. An expectant parent has lots of things on their mind. And this is just one more thing that's difficult to remember to do every day. I was just at a conference a week and a half ago, and I was teaching lots of different people how to use this app. And ever since then, every single day, I get a little notification. Don't forget to start your kid counting session. So I know that if I were an expectant parent right now, that would be a huge help for me if I was running through my very busy day. Another great feature is you can review your kid counting history. You can download that history to share with your provider. And that gets back to having actual data to show someone, whether it's their care provider, whether it's labor and delivery triage, or for fun, you could even send that to your friends and family. One great feature is when you download that app, and hopefully you guys have downloaded the app by now, when you are initially opening that app up, it's going to ask you to create an account, and it's going to ask you a few questions. And one of those is counting the kicks with multiples. So if you are counting for twins, for example, you can choose that on there. The same app can be used for future pregnancies. So once your pregnancy ends, if you decide to start another one, it will keep the same exact count. And one of our awesome features is that this is available on Apple smartwatches, and also coming soon, it will be a web-based counter. So one great feature of that is that whether you are counting your kicks on a mobile device or a smartwatch or using the web-based counter, all three of these are integrated to your same account, which means on the weekends, you might be doing this from home, but maybe during the week you're at work and you can't access your phone when you're at work. And this is the time of day when you normally are counting your kicks. So the wonderful feature here is that all of these are going to be integrated together. And I want to add one more quick suggestion before I get to the fun part. And that is with your smartwatches, this actually allows you on the go to be able to do your kick counting. And I'm just going to use my sister-in-law as an example. She has 4 children. She's very busy. And so she uses her smartwatch, and every night when she's putting her 18-month-old down to bed and she's laying down with him, that's when she does her kick counts. And the Apple Watch version of it, it's just very discreet. It doesn't distract him as maybe a mobile device would. So it just allows you a little bit more flexibility on when you're going to be doing your kick counting sessions. Okay, so I'm hoping that you all downloaded the app. So how does the app work? All right, so you see that big picture on the left, that huge red button, start counting. And they're going to ask you, do you want to start a kick counting session? Yes, of course we do. And then you'll see that smaller picture on my screen of that cute little foot. So when you start your kick counting session as an expectant parent, as soon as you feel any kind of movement, you're going to tap that cute little foot. And then you're going to tap it again the next time you feel a movement. And eventually all of those little shaded sections on the outside of the circle will get filled up. And that means you've reached 10 kicks. That means that the app is now going to log how long it took you to get to 10 kicks. And then it will show you a visual representation of how long it's taken, and you'll be looking at a trend graph. And so the goal is for us to be drawing our attention to significant changes in that graph. Okay, so once they finish tracking 10 of their kicks, the very next question that they're going to be asked is to rate the strength of the kicks. So you can see on the left picture, it says fluttery to fierce. So what we want to, as you heard me mention earlier, we're not just looking for the quantity of kicks and the time it takes, but we want to look for changes in strength, whether that is a decrease in strength or a frantic increase in strength. So it's like a ranking 1 to 5, but we call it fluttery to fierce. So fluttery might be those initial flutters that you feel right when you're just starting to feel baby's movements. Fierce are those really, really strong ones where it almost feels like there's a limb trying to poke out. And we're looking for the pattern of what baby's strength is day to day to day. And one awesome additional feature you can see on that picture on the left is that you can also take notes in there. So if there was anything unusual or if things were normal, you can put notes in there, and that is just data for you to have to present to your care provider if you do wind up needing to reach out to them, or the next time they go in for their appointment and their care provider asks how our baby's movements tracking, you have those notes available to show them. So the two pictures on the right are the most important ones, and the math teacher in me is so grateful to see these graphs. So what we're looking for, the red graph on the top is the amount of time it is taking. The blue graph on the bottom is a vertical bar chart of the strength over time. And so if you look at the very far right red graph, all of a sudden it's taking a much longer time to get to 10 kicks. So let's say this baby, it takes 15 minutes on average to get 10 kicks. And then all of a sudden, one day it takes an hour and 15 minutes. Well, that might signify something could be happening. What is it that's happening? Well, we don't exactly know yet, but that's why we have them reach out to their care provider. That is why we have them perhaps go in and get a non-stress test. Perhaps their care provider will ask them to go get an ultrasound. But there are a lot of reasons why there could be a change in time or a change in movement strength. It could be an issue with the cord, with the placenta, could be a decrease in amniotic fluid, but we don't know that. So this is our early warning sign so that we can go in and ask for baby to get checked out. And again, if the care provider is not available, we recommend that they go to a hospital. Hospitals are open 24/7 for our expectant parents. The risk of not speaking up far outweigh the risk of going in. So it is really important that we make sure our expectant parents know not to be afraid of being that crazy, frantic, paranoid parent. It's really important that we make sure they know that minutes matter. Don't wait and have a good night of sleep and go in the next day, because it just might be too late. And so the sooner that we reach out to our care providers, maybe the sooner we just get baby checked out.
Great. Thanks, Jennifer. So yeah, you all have the app downloaded now. So you're going to see a couple other great features that we wanted to highlight. This one is a free tool that we have in the resources section of our app, or you can access it from that website. And what this is our Find Help resource. So all you have to do is enter your zip code and you can find free or reduced cost services in your area. So this is an example for my area, but you could tell your patients, your parents, your families, here's where you could search if you need assistance doing finding housing assistance or childcare assistance or diaper banks. So it's a really great resource to connect people to local resources in their area. And I know this one's a little bit harder to read, but I really wanted to highlight it because this is brand new. So if you've seen this presentation before, you probably have not seen this, but working alongside the Florida Department of Public Health, one of the things that we wanted to do was address social determinants of health. If we can connect those pregnant individuals prenatally to resources and things that they need to have better outcomes, then let's do that. We already have an audience that's using the app in the third trimester. So let's make sure that we address those needs head on. So that way, when they do have baby and postpartum, they're not worried about things like childcare or lactation or parenting resources. So working with the health department, we came up with these 4 questions. Things like, when things get tough, do you have friends or family that you can rely on? Yes or no? If you have questions about parenting, do you know where to find resources for positive parenting advice? When you feel sad or upset, do you feel like you have healthy coping skills? When in need, do you know where to access resources like food, housing, medical care, financial assistance? Simple yes or no questions that take place after your second kick session on the app. And the last screen there says, if you answered no to any of these questions, please know that you're not alone. Here is the Florida Family Health Line that they can utilize and call. They can go to the website, all within the app. So we're addressing head on things prenatally, thanks in partnership with the Florida Department of Health. So this is a brand new feature that just got announced. And due to the sake of time, I'm going to bypass this video, but this just does a good overview of how to use the app. It's on the app as well, but you can share it with your parents, and I will send the link of it in the email as well. So now you know how to use the app. How do you integrate this? So before we dive into integration, I want to address the fact that by you talking about stillbirth prevention and Count the Kicks, you are improving the health literacy of the people you work with, because you're doing things like you're being equitable, you're avoiding assumptions, and you're providing the same information to all the expectant parents you serve, no matter their race, their gender, their religion, their socioeconomic status, their sexual orientation, their marital status, or the education level. It's the same information and interaction every single time. You're listening and you're learning. You're asking strategic and open-ended questions about kick counting. This is helping you assess what the individual patient understands, feels, and desires. You're using motivational interviewing techniques, things like, let's talk about your baby's movement pattern. What questions do you have about your baby's movement pattern? You're being clear and concise. You're avoiding long or complex explanations and medical terminology. The words we're using today about fetal movement and things like that, you're not going to do that when you're talking to an individual. You're going to talk about baby kick counts, baby's movements. You're also being honest. We'll talk about this here in a minute, but you're speaking the truth. I think we all have this idea that expectant parents are these delicate flowers that we can't talk about information like stillbirth on. And what we need to do is we need to treat it like everything else we talk to expectant parents about, and we need to speak the truth while still practicing empathy and compassion. You can do that at the same time. And then you're reteaching. This is why it's so important to talk about every single time you see somebody in the third trimester. You're talking about fetal movement monitoring, because if they ever display confusion or lack of understanding, you're going to correct and clarify. You're providing that extra support. Let's talk about it. What questions do you have? Let me see the data that you've been collecting, things like that. So that's how you bring in health literacy. So Jennifer is going to talk a little bit more about how to have the conversation with expectant parents.
Okay, so when you're talking with expectant parents, some of the concerns that we hear from care providers are things like, I don't want to scare our expectant parents. Well, we have no problem educating them on the dangers of drinking alcohol, on the importance of taking prenatal vitamins. So there shouldn't be any more scariness to teaching them safe, non-invasive ways to prevent stillbirth from happening. Sometimes we hear, well, stillbirth just happens. There's nothing we can do. That is what my husband and I heard. Sometimes these things just happen. Well, there can be early warning signs. And so we want our expectant parents to know what to look for. On the bottom right, we'll see she's almost at her due date. We hear that one a lot also. Well, the risk of stillbirth, unfortunately, increases as an expectant parent approaches their due date and exceeds their due date. And then the last one we hear a lot, and I hear this a lot from expectant parents that I'm talking to, is that, oh, well, her baby is always active, so it's not a concern. But the issue is that babies are active until they aren't. And sometimes cord and placenta accidents can be very sudden. So we want, in fact, our expectant parents deserve to know what is considered normal so that they know when there is a change with their baby's pattern. This next slide is about how we can talk to expectant parents who have had a stillbirth previously. And so, of course, we want to follow the same protocol and teach them how to use our app and how to properly track fetal movement. But one really strong piece of advice I would give you is please read the chart prior to entering the patient's room. While I did not have a pregnancy after my stillbirth pregnancy was after a miscarriage. And having to repeat my history out loud to someone who hasn't read my chart is very triggering. So please educate yourself before you walk into the patient's room. And then since birthing parents have had a stillbirth, that actually means that they are more likely to experience another stillbirth. So that would make them a high-risk pregnancy, which means we would want them to start tracking their baby's movements at 26 weeks instead of the 28 weeks. We recommend that you feel free to talk to the expectant parent about their baby that died. I think most parents would look for an opportunity to talk about their baby. It's okay to ask them their name. It's okay to ask their gender. It's okay to ask open-ended questions and let that parent share with you what they want. And if they're not ready to share that, that is okay too. But maybe they need someone to talk to. And as their care provider, this is an opportunity for you to listen to them and maybe get a feel for if they're experiencing any anxiety, any concerns about mental health. I would recommend you stay away from medical terms like fetal demise. That is something that's on most of our hospital discharge papers, and that is difficult to hear. Be empathetic. Please feel free to refer to their baby by their name if they named their baby and if they shared their baby. And then this last one, please ask if anyone has talked to them about the importance of tracking fetal movement. We hear from way too many parents who have had previous live births, no problem, and they've said that they have never been told about the importance of tracking fetal movement. Okay, so Jody, I was wondering if you could help me out here. I know that there are a lot of myths out there, and I was hoping you could share with us whether these myths are true or false.
Yes, I am happy to do that. You mentioned, Jennifer, that your baby Jonah was active towards the end. And some people may think that you don't need to count your kicks when that's happening. And that's actually false. Even active babies can experience distress, sometimes quickly and without other warning signs, like what Jennifer said happened in her case. Tracking your baby's movement every day really takes the guesswork out of knowing if a normally active baby has slowed down. Count the Kicks gives you real data to show your healthcare provider if you have any concerns at all.
What about, sometimes we hear that only high-risk pregnancies need to count kicks and that low-risk pregnancies are fine.
Yeah, really all expectant parents should be educated on Count the Kicks and should get to know what's normal for their baby. That's really important.
This is probably the most common thing that I heard from books and apps, and that is that a baby should kick 10 times in 2 hours.
Yes, that number, or that research rather, is outdated. Now, it's important to note that every baby is different, and current research shows that moms should work to understand the normal amount of time it takes their baby to get to 10 movements each day. That normal is kind of or that word normal is a word that we've used a lot throughout this presentation. You, as the expectant parent, need to find what's normal for your baby and realize and count how long it takes for them to get to those 10 movements each day.
What about using a Doppler device to monitor the baby's well-being? Is that good enough?
It's not good enough, although it is sweet to hear that heartbeat on the Doppler, but a change in the baby's heartbeat is actually one of the last things that occur when a baby is in distress. A change in a baby's movement may indicate that there are potential problems before actual changes in the heart rate are detected. Expectant parents should only use a Doppler device under the guidance of their healthcare provider.
All right, we've got just a few more. So if baby isn't moving, should I drink cold water or eat something sugary to get baby moving?
Oh yeah, this is something we hear often, and that's false. Research has moved away from the idea that sugary or even cold drinks are a good way to get baby to move. Kick counts are best monitored without those types of interventions. If your baby is not moving like normal, parents should speak up to their provider right away.
Do babies kick less near the end of their pregnancy?
No, they actually don't. Babies do not run out of room at the end of pregnancy, although it may feel like it. The types of movements may change a bit, more jabs and fewer rolls, but babies should be moving up to and even during labor. If an expectant parent is monitoring their baby's movements at the same time each day, it should take about the same amount of time to feel those 10 movements.
Do you think that triage should be bringing Count the Kicks education to their patients?
Yeah, they absolutely should be having that information and that knowledge in their own heads, as well as the materials throughout that department. Posters and brochures and discharge papers should all be used when someone comes in for anything and is sent home.
And what about dental care? How important is that for pregnant people?
It's extremely important. Pregnancy can increase an expectant parent's risk of dental issues, thus overall health issues for expectant parent and their baby.
All right. Thanks, ladies. So I'm going to jump to this slide super quick. And the reason why is because we have over 100 people on this webinar right now. And one of the things that I wanted to mention, because I know we're going to go about 5-7 minutes over, is the fact that because of this partnership with the Florida Department of Public Health, you have access to all of this material, all of these print materials for free. So right now, Jody's going to go ahead and put in the chat the link directly to order materials. But if you ordered right now during this webinar while we're finishing up and wrapping up, you will be entered to win yet another gift card to Count the Kicks. So we have promo posters, how-to posters, app reminder cards, brochures, and we also have picture-based material. And in Florida, you have all these materials in English, Spanish, or Haitian Creole, and soon you will have all these materials in Portuguese. So we are so, so excited to have all of these pieces for you to put up into your triage rooms, to put up into your restrooms. Libraries can order these. So make sure I should get an email from all of you ordering right now, because we get the notifications to get entered into that gift card, but also to just educate and have out, because the more touch points, the better. So while you do that, we're going to wrap up, talk about a couple other ways to integrate. So I just said the discharge paperwork, right? That is a great way, because I went to triage 3 times with my daughter. I didn't understand that 30 minutes was her normal, and I got checked out. Everything's fine. She's now a healthy and happy 7-year-old. But that would have been the perfect opportunity for triage to have this information on Count the Kicks into that. So have that in there. Talk to me. One of my favorite things is about system level change. How can we integrate this into your workflow, into things you're already doing, so it makes it easy to remember? Maybe you include it in your family care plan, where you find out they're pregnant at 12 weeks and you put a flag on their note and put it in your calendar that you're going to talk to them about Count the Kicks later on. Make sure your entire team is trained on this. So there's a lot of different ways you can integrate this. Feel free to reach out to us about that. And then Jennifer is going to just wrap up with a couple other resources, and then we're happy to stay on and answer any questions. And thank you so much for staying on. Otherwise, hop off, and this is being recorded and we'll send it. But go ahead, Jennifer, and share about these resources.
Oh, thank you so much. So there is continuing education training. It's worth 2.2 units. And this is sponsored very generously by the Florida Department of Health. And so this is an opportunity for an educational activity to train our healthcare professionals on how to talk to their patients about fetal monitoring and how to teach them to use best practices to track fetal monitoring. This is evidence-based, it's non-invasive, and this is one way that providers can help prevent stillbirths from happening. So this link that you see here is where you can access free training, and this free code is available. Again, thank you to our Florida Department of Health. They are amazing. Megan is actually at the end of this presentation. She is going to send out this link and that free code to all of you. So don't worry about writing that code down, but this training is free. We encourage everyone with touch points with our expectant parents to take advantage of that. And then on our app and on our resources and on the website, there are some amazing resources. There is a whole section called the Parent Academy. That's for our expectant parents. There is a whole section called the Provider Academy with information on how to implement this program. Samples of kick counting charts are available in all 3 of those languages with Portuguese on the way, and so many videos. So if for some reason a person is not able to sit there side by side and teach an expectant parent, you could show them where the video is and then have them watch that video.
Thanks, Jennifer. And then finally, we have with the Florida Department of Health, there are 2 websites that we've partnered with them on. One is on their public facing webpage there that talks more about Count the Kicks, goes into a little bit more detail of Count the Kicks that you can access. And then the other is a page that you can really only access with the link there. That's our state partner page. So this is where you can find and see how many materials have been sent out across the state, how many app downloads there have been across the state. Any recordings will place there. So it's an internal type of link that you need access to, and I will send those out as well with the final webinar email. So this gets updated about monthly with the reports and the data metrics that you all can have access to as well.
And another resource that you have available are your ambassadors. So I am your ambassador, but we have ambassadors across the United States, and these are all women who are volunteers. They are very passionate advocates due to their own personal experiences like me. And what can we serve as a purpose for you? Well, we regularly attend events, medical conferences, baby fairs. Sometimes we give media interviews, and we're constantly working to grow partnerships, especially with like partner agencies. We help fundraise. And for all of you on this call, if you need resources or you have some event going on, please feel free to contact me as your ambassador. And when Megan sends out her follow-up email, she will include my email address on there. I am more than happy to help you in any way that I can.
All right, so now that we have learned more about the app and how to implement it, it is time for you to familiarize yourself with our free app. If you haven't downloaded it already, go ahead and do that and practice using it. It's so super simple. Also, ordering those Count the Kicks materials is another great next step. If you haven't taken the time to do that already, you can designate that task to someone in your office to manage that. And those resources are free on our website. We have that link to order those materials in the chat, and we will also send that out in the follow-up email. Also, make sure to spend a few minutes with your clients and your patients to educate them on the app and making sure that you have that important kick counting conversation at every touch point in the 3rd trimester. When they walk in to schedule their appointment or to check in the bathroom, when they go to take their urine sample, or even, you know, of course, talking with the patient in the room to let them know about the importance of kick counting. Also, it's really important that everybody on your team knows the importance of fetal movement and how to track that. And you also, as we mentioned before, making sure that you document Count the Kicks on the papers and documents that you already use as your standard operating procedures in your clinic. You can put that information in the EMRs or the intake forms, or even on the discharge papers if they happen to go to the triage for the labor and delivery triage. You can document that, and that's an easy way that you can make sure that your patients are aware of kick counting without having to, reinvent the wheel and make another procedure for your place of work. And lastly, it's really important to remember that hours and minutes matter in preventing stillbirth. So make sure to educate your expectant parents and your staff on how to expedite those concerns regarding movement if an expectant parent walks in and says that this is happening to them. This is the impact of our work. We have over 100 baby saves and counting, 33 families or families from 33 states all across the country, and 5 other countries have reported to us that Count the Kicks help bring their baby here safely. So this is the exciting part of our work and what we are aiming to accomplish here. And do we have some time, Megan, to play baby Nala's video?
Yeah, if you all want to stay on, feel free to jump off if you'd like, but we will play this video. It is a great story, and it just hones in on why we do what we do. So thank you all. We'll stay on after this video to answer any questions, but let's go ahead and watch Nala's story.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if? Definitely to pay attention and count the kicks, I feel like it's important just because had I not, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, because your baby might not be here. You just pay attention, seriously, like it's your baby's life. She came back.
Yeah, that last line that Nala's mom, Dana, said just rings so true. As someone who was recently pregnant, being concerned about going to the hospital and racking up another, bill from the emergency room is, kind of the last thing that you want to do, but it is your baby's life, and you do not want to have any regrets. So we're so thankful that baby Nala and dozens and dozens of others are here because of Count the Kicks. So of course, we want you to connect with us. You can reach out to us in a whole bunch of different ways. You can see all those lists on your screen there. We would love for you to connect with us and continue to partner with us in the future. And thank you so much for joining us. And we apologize for going a little bit over. We have a lot of important information to share. And we know we gave you a lot of it in a short amount of time. But if you have any questions, we would love to hear from you at this time.
Yes, thanks everybody. I do see one question in the chat right now. Unati. Hopefully I pronounced that correctly. My apologies if I did not. The presentation to share. So I'd love for you to email us, because we do, if it's a childbirth ed class, we do have like sample lesson plans you could use. Oh, perfect. Thanks. We do have sample lesson plans that you can use. And we do have different presentations for like specifically expectant parents versus, so I'm not sure what class you mean, but if you want to contact us, and I'll put my email here in the chat, and then we can get you what you need. It might not be this full presentation, it might be just part of it. So I will do that. But yeah, sign up for the newsletter, then you guys will know when the web-based kick counter. Be on the lookout on the website for the Portuguese materials that should be out any day now. And we just thank you so much from us and all you for doing everything that you do. Thank you.
Yeah. Have a great afternoon, Donna. And everyone else, of course.
Yeah. We'll stay on a couple more minutes. People log off. I'm going to stop recording.
Thank you all so much for sticking around with us.